Hi, everybody. I'm Target 12 investigator Tim White, and I'm joined remotely by my colleague, WPRI.com reporter Eli Sherman. He's also in the investigative unit with me. Hi, Eli. It's good to see you again.
Hey, Tim, good to see you too.
So, you've been looking into some predictive modeling when it comes to COVID-19, and you initially turned to some experts at Washington University. They put out some data that I want to share here just so our viewers can get a sense of what we'll be talking about as we go through all of this. So this is on the WPRI.com website, again, from Washington University. And Eli, as we go through these different charts and we see this sort of peak, this mountain here, and this is the curve, you hear the governor talking about flattening the curve. It looks to me that the epidemiologists at Washington University think around April 19th, the cases and the demand on our resources in Rhode Island is going to peak. Is that how we should be looking at this?
Yeah, I think that's exactly right, Tim. Essentially what they did is they gathered a bunch of data in terms of what it is that we use in our hospitals around this time every year, and they calculated the gap between what they think the projected demand will be, what we'll need to respond to this pandemic locally, and what's typically available. And they figured out that not only will we be peaking at about April 19th, but also that in some instances we may not have the resources needed to meet that demand. And that fits into the narrative that the governor has been saying almost repeatedly now about how we're not quite ready to meet the surge that is inevitably coming, as you can see from this model, but also from the increased number of cases and deaths that we've been seeing as of late.
And this is the projections on deaths they have here. This is they're projecting roughly 8 deaths a day here. But look, it can go. They have this wiggle room in here. This is sort of the margin of error. If you're looking at a political polling, it could be as low as 4 deaths a day to high as almost 16 deaths a day. Again, this is here in Rhode Island.
That again, right, Tim. We're seeing deaths already grow. I think the first one was reported on Saturday, the first 2, I should say, and already today there were 4 more. This is projecting again to that mid part of April being the peak that will plateau there at about 8 deaths per day. Whether or not the modeling gets shifted slightly day to day, that's a total possibility, especially as new information becomes available. But for right now, that's what we're looking. And if you go down a little bit lower too, Tim, it shows that projections based, again, on this modeling that goes through August 4th, they're counting roughly 260 COVID-19 related deaths during that time period.
So wait, talk to me again here, Eli, what we're looking at here, 259. These are total deaths in Rhode Island. Is that what they're projecting?
That's correct. And if you see there above the death count, 259, it says that the projection goes to August 4th. Now, of course, as you mentioned in the margin of error here from high to low, it could vary quite a bit. But as it stands now, that's their best guess as to how many people will die from this disease, at least through their modeling that goes to August 4th.
Okay, so this is the modeling from Washington University, Eli. Earlier today, and we're taping this on Tuesday, you asked Governor Gina Raimondo, remotely anyway, at her daily press conference, if the state is doing their own modeling, and here's some of what she had to say.
Our model looks a little different. Our model would suggest that the peak is further out, but also higher. Having said that, we're still working the model. None of these models are precise enough. At this point, we still have limited numbers, 8 deaths, 59 people in the hospital. We're reaching out to Brown University, Johns Hopkins, our own top-notch epidemiologists at the Department of Health. So I would say that model is directionally correct insofar as those numbers are probably in the ballpark, but we're still refining our model to reflect the actual experience that we have here, and we're probably at least a few days or a week away. Again, we just need more data to populate our model.
That was Governor Gina Raimondo when Eli Sherman asked again remotely about if the state is doing any modeling. What do we know, Eli, about the state's approach to their modeling?
Yeah, so far, Tim, they've been a little bit reserved in sharing too many details. Actually, I think that the governor's saying just there that they were close to what Washington University was projecting is the first time that they've made mention publicly of it. The reason being is that they testing, the access to testing and the inability to get that daily testing up to the point that they want to be at, which is about 1,000 per day, has limited the input that they can put up into their state-based modeling. But we do know that the state Department of Health is partnering with Brown University and maybe some other institutions to create state-based modeling that is looking at exactly what Washington University is looking at a state-by-state basis, but of course might have a variety of other things that they might be looking at, including cases, and who knows, there could be a wide variety of things.
Before we wrap up here, Eli, I want to just go back to the modeling that we were looking at earlier. And one thing you corrected me on, because I read it a little bit differently, and maybe some of our viewers are going to read it differently. And I just want you to clarify here, when Washington University says here in this number that there are 41 ICU beds available, we shouldn't read that to mean that's how many ICU beds are available in Rhode Island at any given, at this moment. That means something slightly different.
That's right, Tim. So basically the way that they've done this is they've calculated how many ICU beds are typically available during this time period, which is 41. Rhode Island, the Department of Health tells us that there are about more than 188 ICU beds across the state. But what Washington University is showing is that, again, at this peak date, April 19th, the typical usage of those ICU beds is roughly 41 less than what the state has, which means that based on their projections that we're going to have an 80-bed shortfall when it comes to ICU beds.
And again, that's sort of the middle ground of the curve there. If they're at the higher end of what we're talking about here, that number changes dramatically, and that would definitely be a scary change. All right, Eli Sherman.
Great point.
Eli, thank you so much for all of this information. If you're watching this video, you're watching it at WPRI.com, so just scroll down below this video and you can read Eli's complete write-through of all this information right here on WPRI.com.